Morning, everyone. Hope you guys are having a good week so far. I'm going to give some time for people to hop on here. We'll get started here in about 2 minutes or so. I'm going to get my slides set up. If you guys could put in where you're tuning in from, that would be awesome too. I don't know if you guys are in the Oakland area. I've had a few people hop on here from Southern California, I think Washington, I think Arizona too in the past. So always curious where everybody's tuning in from. If you guys could drop that in the comments, awesome. And then if you guys can hear me okay, let me know if you guys put in the chat yes or no. That would be awesome. I'll make sure you guys can hear me loud and clear before we get started. And we'll get started in just about a minute. I'm going to let some people hop on here real quick. Then what you guys are going to need today is you're going to need a yoga mat. And possibly a foam roller. If you guys could just grab those two things while you're waiting for me, that would be awesome. Laura says, Santa Cruz, Oakland friend referred me. Awesome. Well, welcome, Laura. Happy to have you. I was actually just in Santa Cruz, I think it was 4 weeks ago. It was right before the fires kind of started happening down in that area. Carly says, LA, awesome. Welcome, Carly. Glad to have you. All right, guys, we'll go ahead and we'll get started. So I want this, first of all, I want this to be super interactive. I don't want this just be me jibber jabbering to myself. I want you guys putting in the comments. I'll be asking some questions, and these questions help guide this workshop as well, because I want this geared towards you guys. I have my general layout on how I do this workshop, but if I know a little bit more specifics about what you guys are dealing with, I know we're doing a back pain in this sciatica workshop, but there can be different causes to these different issues. And so I want to tailor that to you guys as much as possible as well. So first of all, before we get started, I want to kind of introduce myself and stuff like that too. First of all, if you're watching this training because you want to learn how to fix your low back or decrease the sciatica symptoms you might be experiencing, and learn how to work out, again, free from back pain, then you're in the right place. For those that don't know me, my name is Dr. Ben. I'm a physical therapist with Pro+Kinetix Physical Therapy and Performance. We're located in Uptown Oakland, right across from the local YMCA. And we specialize in helping active adults and athletes in the Oakland and surrounding Bay Area get back to workouts and sports they enjoy without having to use injections, medications, or surgeries, or anything like that. We've also actually worked with quite a few people in Southern California as well, virtually. So a lot of our patients actually moved to Southern California due to COVID. There's so many people leaving the Bay Area. So we've been helping people virtually as well, so not just locally here in Oakland. But yeah, that's a little bit about me. One other thing is every physical therapist on staff here is also a strength and conditioning specialist. We're not just physical therapists. We also have that kind of dual degree there. So that really helps us bridge that gap between rehab and performance and getting people back to their active selves and active lifestyle. So, and then I'm super passionate about this topic because I too used to have back pain and sciatica symptoms. This was long before I got into physical therapy school, and I know how frustrating it can be. It's really debilitating and impacts until you have back pain. You don't realize how much you use your back. Like even the littlest things, you notice it, and it can be really, really frustrating. So, and I went to a couple physical therapists, I went to a couple physicians, and when this was happening, and they all told me, just take some rest. I was doing a lot of workout. I was working out a lot. I was playing a lot of basketball, football, and doing a lot of strength training. And they're like, yeah, you're just gonna have to stop doing the squats and the deadlifts and some of these other exercises that are causing some of this pain. I'm like, well, that's not gonna happen. Like, at the time I think I was 20, 21, 22, and I was like, this is ridiculous. What am I gonna be like when I'm 75 or 80? Like, how bad is this back pain gonna be? And I really don't want to have to live my life not doing the sports and activities that I love to do. Like, that's, in my opinion, that's no way to live. So anyways, I kind of just kept pushing through the pain, and which wasn't the right thing to do. Don't get me wrong, but at the time I was just like, I'm not willing to give up my active lifestyle. And so kept pushing through it, and I kind of did some treatment on my own, and then I found this really, really great PT that was able to help me. Somebody that really kind of understood the demands of like sports and like weightlifting and strength training, and running and just the activities that I was trying to get back to. And because he had that same background as well. Anyways, I got into physical therapy school, and I realized how ridiculous it was that I went to a handful of practitioners, and they all told me the same thing. Oh, well, just stop working out, or just stop doing, if it hurts to do that, just stop doing it. Well, that's not any way to live. And this is something that, as I've gone in my career, I'm noticing it more and more. Like, most of our patients that we see are ones that have gone to a physician, gone to a physical therapist, chiropractor, and they're all told them the same thing. Oh, well, if it hurts to do that, just stop. It's ridiculous. In my opinion, that's what's kind of wrong with this medical system, because there is a solution, okay? And it's a solution we've helped hundreds of people find. And so I want to kind of share that solution with you guys today, and show you that it is possible to get back to being your active selves, and back to your active lifestyle as well, okay? So that's one big piece that I want you guys to take away from today, is that this is fixable, and something that you guys can get back to, okay? So I also want you guys, so I talked about how I want this to be interactive. I want you guys to put in the comments how long this has been going on for, how long you've been tolerating and putting up with this low back pain. I ask this question a lot of times. People, I do these workshops in person. If it wasn't for COVID, I used to do these in person, and I'd have everybody raise their hands, and I would tell them, okay, everybody keep their hands. You can put your hands down if you've been experiencing this pain for less than a decade, 5 years, and then a year, and then 6 months, and then a month. And it's amazing how many people have been dealing with this pain for over multiple years, even decades. Every time I do this workshop, half the hands are up when I ask if how long people have been dealing with this, and it's been for over a year. And it's just so unnecessary too, because there is a solution, okay? So go and put your comments in how long you've been tolerating and putting up with this low back pain, and then also comment what you're unable to do because of it, and kind of how it's impacting your life, such as, like, is it impacting your sleep? Is it impacting the way that you're exercising? Kind of walk me through, how it's impacting you guys, and I'll be addressing those things as well. And by understanding how long this has been going on for, and how long, what you're unable to do because of it, there's patterns with back pain and sciatica symptoms. There's a pattern to this, and by telling and kind of figuring out what you guys are struggling with and how long it's been going on for, I can start piecing things together and tailor this workshop to you guys, okay? So Laura says, 15 years, started as a dislocated tailbone. A good PT finally found it last year. General back pain from computer work. Okay, awesome, Laura. Well, I'm glad you found a great PT that's able to address this as well. But yeah, so this is a perfect example. I hope you don't mind me using you as an example, Laura. But so you see, Laura's dealing with this pain for 15 years, and she finally found a good PT last year, and now it's starting to make improvements, right? So she could have found that PT. Laura could have found that PT 15 years ago, would have saved 14 years of having to deal with that. So the solution is out there, guys. All right. Carly says, just started about a year ago. Had a huge episode this week. I could barely walk on Sunday. Yeah, so Carly, that's another thing too, is as most of you guys know, like back pain fluctuates a lot, right? It kind of comes and goes. We have flare-ups, and sometimes it's unpredictable. It's unpredictable because of different. We could have sat for longer periods that day or that week. We could have been more active that week, and there's just random things that can kind of throw us off. So Carol says 10 years and sleep deprived. Yeah, so that's very, very common with back pain, Carol. It's very, and I remember this too when I was having back pain. It can be so difficult to find that proper sleeping position as well. All right. Laura says can't get comfy with sleep unless I work out a lot too. I am doing too much. 45 minutes cardio a day, run, bike, etc., and then start sciatica flares. Okay. All right. So first of all, Laura, congratulate you for continuing to be active. A lot of times people will just do bed rest. And that actually used to be the kind of prescription for low back pain back in the day, was, oh, if you're having back pain, just do a week of bed rest. Turns out that the research shows that's like actually one of the worst things that you get that people with back pain can do is rest. You want to keep being active in a way that's not tolerating it, okay? And then Carly says, interesting because I also have an injured tailbone. Okay, so I'm going to kind of tailor it to that injury as well, guys, okay? Remember it says, sitting for distance teaching is killing me. So yeah, that's one huge thing that we've seen an uptick in since COVID is so many people are working from home now. And when they were going into work, they were moving around a lot more, and a lot of them also had standing desks. And now a lot of people are working from home. They don't have the standing desks. They're more sedentary. So people are sitting a lot more, and that's leading to some low back discomfort. And we'll be going over some ergonomics too, guys, today with regards to that low back, okay? Laura says bed rest equals kills. Yes, exactly. So Laura's kind of an expert with this for dealing with her 15 years. So yeah, Laura, you don't understand, like bed rest is actually one of the worst things that you can do. All right. I was in the same boat, Laura. When I talked to that PT and the physician, they told me bed rest too, to a certain extent. And yeah, so I'm on the same page with you and understanding, like, yeah, that's not work. Great. Thank you guys for being interactive and kind of filling me in with that as well. So once you guys know, again, this isn't your guys' fault. It's really like the practitioners that weren't able to find a solution for you. Okay. And like I said, luckily there's a solution, and that's what we're going to be kind of going over today as well. Okay. So let me pull up my slides here. So objectives today that I want to hit and make sure that you guys get the answers to. So I want to identify the most common causes of back pain and also common causes of the sciatica symptoms as well. Go over effective treatment for these types of injuries, and then strategies for prevention of this injury, and give you guys some actionable stuff that you guys can start doing right away today to start getting some relief with this. So, and then most importantly, I want to answer any questions that you guys may have, okay? So if any questions come up or something doesn't make sense as we go along in this workshop, just go ahead and put in the comments whatever that question is. You're not interrupting me or anything like that. I want to be addressing these questions as they come in, because most likely I just didn't do a good enough job of explaining things, and most likely somebody else has the same question as well. All right. So kind of want to just go touch on some points about how prevalent back pain is. So it's the single leading cause. Oops, like this. Flip it out. There we go. So back pain is the single leading cause of disability worldwide. All right, years lived with disability caused by low back pain has increased by 54% in the last 15 years, okay? And this is most likely due to the increase in the amount of people that are sitting throughout the day, okay? 80% of the population will experience back pain at some time in or some point in their lives, okay? So you guys aren't alone. This is something that's super common, unfortunately, and yeah, it's something that people shouldn't have to be dealing with. Okay, $50 billion in healthcare costs each year is caused, or that's the expense of back pain for employers, for people that are going, or that are employees and going to getting care, and just overall healthcare costs. So super prevalent, and something that's becoming a big problem in today's world. Okay, so I will go briefly over the anatomy as I go through some of these different types of injuries, because if you guys understand the anatomy, it's gonna make much more sense for what's going on and why we're doing the exercise that we're doing and how it's gonna help. Okay, I want you guys to understand your bodies, because the better understanding you have, the better chance you have of being able to help yourself as well. Okay, so I want to talk about, first of all, herniated discs. Sorry, we're having an ambulance go by. I'm not sure if you guys can hear that or not. Okay, they're passed. So yeah, so herniated disc is one of the main causes of back pain, as well as sciatica. Sciatica can also be caused by a couple different reasons. Okay, it can be coming from the back, it can be coming from the hip, it can be coming from the nervous system, and there being too much tension there as well. Okay, so we're going to be kind of pinpointing and doing some tests to figure out where that restriction might be coming if you're experiencing sciatica, because I have a lot of times people come in with sciatica-like symptoms, and they thought that it was coming from the back, so they just went on like YouTube and searched what are the best exercises for low back pain, and so they do all these exercises that are geared towards the low back, and actually the symptoms were actually, and the reason they're having the sciatica-like symptoms was coming from their glute area or their hip area. And so it was actually, in a lot of cases, it was actually those exercises were actually making it worse. So we want to make sure that we're zeroing in on what the actual issue is as well. Okay, so I talked about the herniated disc and how this can cause sciatica. So the reason for that is, so I'm going to kind of use a model with my hands here. So we have our low back. Okay, if you guys look at my low back here, if I sit up with good posture, you guys can see that there's a natural curvature here, right? Okay, you guys see that small curvature? If you sit up nice and tall, you'll see that in your low back as well. Okay, everybody has that. So we have that gentle curvature of that low back. Okay, then we have the vertebrae that are stacked on top of each other. In between each vertebrae is a disc. Okay, that disc is full of fluid. All right, and then on top of that, we have the vertebrae that are just bone, solid, rock solid bone. Okay, so when we have that normal curvature and have that natural position of the or that neutral spine, that weight dispersion of the vertebrae sitting on top of the disc, and then the disc sitting on top of the vertebrae, that weight is equally dispersed around that disc. Okay, however, if we start losing that positioning and we start rounding out or sitting with bad posture, okay, or if we slouch like this, do you guys see how my low back is rounded out now? Okay, or if I'm doing like picking up weights or picking up something off the ground like a laundry basket, or bending down to pick something else up, and I round out my low back, this is what it's going to look like. Okay, so how does that cause disc herniations? The reason for that is, instead of having that natural curvature, we start getting that rounding position. Now that vertebrae is putting a lot more weight or pressure on that front of the disc. It's no longer equally dispersed around that disc. Okay, now it's pushing on that front part of that disc, and again, that disc is full of fluid. It's going to go somewhere. Okay, it's got to go somewhere. And so what it does is, if you put pressure there, it's going to start pushing that disc posteriorly or towards the back. Okay, and that's how we get disc herniations. Okay, and then guess what? On the back side of the spine, we have nerves that pass out through the back. And when that disc gets herniated and pushed backwards, it can hit one of those nerves. And when it hits one of the nerves, we can get zinging and the pain down into the legs and the glutes, and down into the back of the legs, all the way sometimes even into the foot if it's bad enough. Okay, so that's herniated disc. And sometimes we don't, even though we have a herniated disc, that pain might be localized into that low back. It might not actually go down in the foot. Again, everybody's a little bit different. If you guys could put in the comments if you guys are having any of that radiating symptoms. Are you guys having anything down into the leg or into the back of the calf or into the foot at all, or is it pretty localized to that low back? If you guys could do that for me and answer that, that would be awesome. And that'll kind of tailor where the rest of this workshop is going to go as well. So, and then we also have degenerative disc disease. So as we age, that disc starts narrowing. We start losing that fluid. So that means the vertebrae are a little bit more close together, and so we can get some irritation and some grinding on the vertebrae on top of the other one. And this is just going to be exaggerated more if we have poor low back positioning as well. Okay. Obviously says localized to my lower back. Laura says not currently, just glute. Okay. All right. Good. That's good to know as well, Laura. All right. And obviously, thanks for answering that. That's awesome. Appreciate you guys taking time to answer that. And then we also have spinal stenosis. Okay, spinal stenosis. Based on what you guys are telling me, I don't think you guys are dealing with a whole lot of this, so I'm not going to touch on it a whole lot. But if there's somebody out there that's dealing with this, I'm just going to go briefly over it. We have, so as we age, we talked about how that disc starts narrowing. Well, what can happen is when that narrows and we start trying to go into extension or start bending or going into over extreme, even neutral positioning or hyperextending like this and getting too much arch, what can happen is the back part of that vertebrae will start pushing on those nerves. The vertebrae will actually start pushing on the nerves, not the disc, because that disc is losing space, and so this space is narrowing, and there's a space that that nerve has to exit out of. Anyways, it pushes back on that nerve and causes zinging down the down the leg. So if you guys see, one thing you guys can tell, 9 times out of 10, if you see somebody in the grocery store walking and they're leaning over their cart and pushing it, 9 times out of 10 they have stenosis. And some of you guys may be doing that too. So that's a classic sign of, I talked about how I asked you guys earlier to let me know what you're having pain with. And so I was waiting for somebody to see if somebody said like, oh, if I walk for long periods of time, or if I have to kind of lean over something like in the grocery store, that would be a classic sign of stenosis, okay? But nobody put that in there, so I don't think anybody's got that going on. Carol says, yes, legs. Okay, all right. So thanks, Carol, for answering that. So yeah, so some of you guys can see how this all presents very differently. If somebody's having pains down into the glutes and the legs, a lot of it's, yeah, due to the sciatic-like symptoms. Those are sciatic-like symptoms, and it can be coming from, yeah, that low back or the glutes. Sometimes it can be localized, like with Bobsy, just in the lower back, okay? So the other reason, we talked about the disc, the other thing that can be causing it is what's called is piriformis syndrome, okay? Or the piriformis muscle. So we have, just with regards to anatomy, bear with me on this. I know it's not the most fun topic, anatomy, but again, if you guys understand this, better you can help yourselves. All right, so we have large glute muscles, okay? We have the glute maximus and glute medius. Those are the big glute muscles located in the butt, all right? Underneath, we have 2 different layers, okay? Those big muscles are on the outer layer. Deep underneath that, we have a bunch of other smaller muscles, one of them being the piriformis muscle. It's a very, very small muscle. It's about this long and about this wide, okay? So it's not a very big muscle, right, compared to these big glute muscles. Obviously, it's not supposed to be doing a whole lot of, it's not supposed to be doing as much work as these large glute muscles. However, if these large glute muscles, this glute maximus and glute medius muscles are weaker, what's going to happen is that small little piriformis is going to start taking the brute force of this work that the glutes are supposed to be doing, okay? And what happens to muscles, if they become overworked, they start getting really tight and irritated. And when they get tight, so another thing too is that sciatic nerve, I'm going to tie this all together in just a second. That sciatic nerve passes out through the low back, then travels down through the glute, down into the back of the leg, down into the foot. When it passes through the glute, it's actually passing under the glute area, it's actually passing underneath that piriformis. So if that piriformis is really tight, it's going to compress down on that nerve and cause some of that zinging down the leg, okay? So we got to figure out, is it coming from the piriformis, is it coming from the low back? Sometimes it can be both, all right? Maribeth says, I injured my piriformis in 2016 running my last half marathon. So that's common too. Remember that is with running too is piriformis pain. Absolutely. Okay. Laura says at the end of the day, I just need to lay down. Laura, question for you on that. When you say lay down, is it relieving to lay on your back or lay on your stomach? Okay, and I'll show you guys why that's an important piece to this in just a second. So hopefully that makes sense with regards to the piriformis, guys, and what how that can be causing some of the sciatic-like symptoms as well. Okay, so another type of back issues that can be going on is muscle spasms in the low back. So why do these happen? These muscle spasms happen very similarly of why the piriformis is getting tight. It's just other muscles aren't doing their job. So the muscles that usually spasm in the low back are these smaller muscles, just like the piriformis. These are smaller muscles, and they're not supposed to be doing a whole lot of work. We have a muscle that's called the transverse abdominis. It's like your built-in back brace, okay? And it's supposed to be the thing that's supposed to be providing the stability for that low back. If that core, that transverse abdominis, is weak, what will happen is these other smaller muscles around the spine will start spasming to help provide stability for that spine, because the spine wants stability. And if it's not getting it, the body kind of freaks out. It's very important to keep protection of that spinal cord and that spinal column. And if we're not getting that stability, the brain starts freaking out, the body starts freaking out, and starts recruiting any and every muscle to help provide stability for that, even if that's not the muscle's job. Okay, and so you can imagine if a muscle is not doing is doing something that's not supposed to be doing and getting overworked, it's going to get tight, and that's how we get those spasms. And so a lot of times people will use heat, they'll do a massage, they'll do stretching, they'll get like a chiropractic adjustment, and it'll help for like 2 to 3 days, which is great. But the reason that it goes back to the issue, the reason that goes back to the spasming again down the road, is because the root issue hasn't been treated. The root issue being the core weakness. Okay, and I'm going to be giving you guys some self-assessments that you guys can do during this workshop to figure out what's going on. Okay, and if you do have a weaker core. Okay, so and again, I think a weak core gets overblamed for back pain too many times. Okay, a lot of times there's other things going on, like you guys can see, the disc could be out of place, the piriformis could be tight. Fixing core strength isn't going to really fix those issues, right? Or not fix the entire issue. Okay, so don't just blame it on a weak core. Okay, or don't let other people blame it on a weak core too. Laura says upper back feels like you were saying earlier. Okay, all right, Laura. So yeah, just when you lay on your back, it helps kind of, instead of having that compressive forces, now that we're laying flat, it's kind of giving some relief to that disc. As well, so we're not getting so much compression, and it takes gravity out of the picture. So that's sometimes why you could be getting some relief there, Laura, as well. Okay, so those are the common causes of. Don't get me wrong. There's a lot of other causes for back pain, but 9 times out of 10, you guys are going to fall. Most of you guys are going to fall underneath these categories of disc irritation. Okay. And piriformis issue, piriformis syndrome, or back spasms. Those are, when somebody comes with back pain to see us, that's usually what's going on over 90% of the time. It's one of those 3 issues. So that sounds like what you guys are dealing with based on what you guys are putting in the comments. So that's what the treatment and kind of some of the stuff that we're going to go over today is going to address. Okay. Maribeth says, me too, on the wood floor. Yeah, so that's thanks for reminding me, remember that. What's going to help with low back pain is, especially with regards to a bed. I get this question a lot, like what's the best mattress or best surface to sleep on for low back pain? Typically, it's going to be a more solid surface, okay, or like a more firm bed. Okay, it's usually when we get into a lot of like if we're sleeping on a really soft mattress, that's where we get a lot of low back pain from, and can cause irritation to that too. So if you're thinking about getting a new mattress anytime soon and you're having back pain, I encourage you to get more firm mattress. Not saying you have to sleep on a stone or anything like that, but just get a more firm mattress, and that usually will help low back pain the most versus more softer conforming mattress. Okay, so let's get into some of the treatment and also some of the testing, guys. All right. Before we do that, I want to first address, I know that was a lot of information with regards to different types of injuries and the reasons for it, and the anatomy. You guys have any questions on that I can address before we move on? Okay, because again, it's a lot of information, but I want to try and hopefully I did a good enough job of kind of putting in layman's term in a way that you guys can understand. Okay, so go and throw questions in if you guys have any. While I do that, I'm going to get a little bit into treatment and get started on that. Then I'll backtrack and answer some of these questions that come in. Okay, so treatment. Number one step is find and understand the cause. All right. So a lot of you guys have mentioned that you were sitting more throughout the day. So most likely that's causing some of this. I'm not saying all of it, but it's contributing to it. So if we just did, so for example, if a patient came in and or if you guys just did treatment on your own and did went on YouTube and searched best exercises for low back pain, or I had a patient come in and we started doing treatment to correct some of these deficits, but we didn't first find and understand the cause of this, it's an uphill battle. Okay, it's like there's a fire and we're just keep throwing water on it. Okay, and trying to get it to put out. We got to figure out why is this fire starting in the first place. Okay, if we can just get that, so there's none of that stimulus that's creating the fire, then it's going to make it much easier to contain the fire. The fire being the pain and injury subsequent injury that's going on because of that stimulus. Okay, so we need to first find and understand the cause. Is it the way that we're sitting throughout the day? Is it the way we have a lot of people that come in? I'm going to get on a little tangent here, but you guys might relate to this. I had a patient that came in that was doing some strength training at home as well as going to the gym occasionally, and he was having pain with deadlifting and then also squatting and then sitting for a long period of time. Those were his main three complaints. And he went to a physical therapist, and they said he had a weak core. But what was actually going on, he came in for assessment, and it turns out that it wasn't a weak core at all. It was actually the way that he was moving, the way that he was sitting. It was the way that he was squatting and deadlifting. He was doing it with the incorrect form. And he went to physical therapy for months on months. He went, I think, for PT for 3 months. And he made some improvements, but he said it was like only 10-15% improvement over 3 months. And I'm like, did anybody look at the way that you were sitting or the way that you were squatting or the way that you were deadlifting? And they're like, no, they just tested my core and said it was weak. And so we just did a lot of core strengthening stuff. And so the reason that you only made 10-15% improvement was because they didn't address the root issue. We looked at his squat, his deadlift, and his sitting posture. We corrected those. And within 2 sessions, I think it was two or three sessions, he was pain-free. He kept coming in for a couple more sessions after that because he wanted to, he had been dealing with this for so long. He's like, I want to take advantage of this to make sure this doesn't come back. So he started going through loading up the squats, loading up his deadlift, because that's really what's going to bulletproof the body. And we were able to get him back to squatting and deadlifting more weight than he ever had because we improved his form and his technique with that. So that's just a good story to kind of hopefully show you guys how important it is to find the root cause of what's going on before you actually even get into treatment. Okay. Next step is restoring the range of motion. Okay, so we need to figure out, like we mentioned, like a lot of you guys are dealing with some type piriformis. That's going to limit your guys' hip range of motion. We need to restore the hip range of motion and decrease some of that piriformis tightness or that low back tightness or the spasming that's going on with the low back. Because usually it's the tightness that's causing the pain, okay, that you're experiencing. All right, so again, I told the story about how people go get massages, chiropractic care, use heat to help loosen up these muscles, but then it just keeps coming back, right? What they're doing is they are loosening up that muscle, so which is great. That's the first step. We're loosening up that muscle, restoring that range of motion. However, we need to be throwing in and sprinkling in some strengthening exercises for the core, for the hips, for the glutes, for the hamstrings, stuff like that, so that this piriformis doesn't keep getting tight so it doesn't have to keep overworking for and make up for the lack of strength in these other areas. Okay, so we need to be strengthening up as well as we're restoring range of motion. Sorry guys, keep going on. And that's where I see most people go wrong. Okay, they're doing great with the foam rolling, they're doing great with the stretching, but they're really just treating the symptoms. We need to find the root cause of it, and that's what's the most important thing is 2 things: assess, don't guess. First, figure out what I mean by that is assess and figure out what is the actual problem, and because that's going to tell you the reason that you're having the symptoms and why this is causing pain in the first place. Okay, and then second of all, another big piece: don't just go after treating symptoms. Find the root cause, okay? And you get that through assessing and not guessing, okay? And then another thing is activity modifications. When people are going through PT with us, we are able to find ways to allow them to continue to do 95+% of the activities that they want to be doing. We just have to make modifications to them. Main thing is, like I mentioned, and Laura touched on this too, is how bad bed rest can be. And so we do not want people to stop ceasing activity or actually doing less activity. We actually want them to do as much as possible in a safe, pain-free way. Okay, we just got to find the modifications to do that. So be active, continue to be active. One of the best things that you can do is actually walk. Okay, walking helps lubricate the low back and decreasing some of the tightness that can develop from prolonged sitting. Okay, so activity modifications is huge. Keep being active. One question I get a lot is about back braces. Okay, are back braces good, bad? I get that question a lot. So everything that I've touched on today and everything that I implement in the way that I do physical therapy and how I educate through workshops like this is all based on evidence. This isn't my personal opinion, okay? My personal opinion has maybe a little bit of weight, but not a whole lot, all right? There's case studies, there's all this research out there collected on what works and what doesn't work. Yes, I've seen what there's just being human. You have your own personal people can develop their own personal biases, and I try to avoid that as much as possible. And I can do that by looking at what does the best research say. And so there's tons of evidence and research out there on back braces, and I can say with very high confidence, just based on this research, and then also with what I've seen too, that back braces might mainly do more harm than good in the long run. In the long run. If somebody's having excruciating pain and the only way that they can get out of bed and be functional is with the back brace, I say, okay, go ahead, use the back brace. But in the meantime, we need to be building up the strength and treating this root issue and then weaning them off of the back brace. But most of the time, people don't need a back brace to be functional, okay? So if you don't need a back brace, don't use it, because what that's doing, I talked about earlier, we have that transverse abdominis being that built-in back brace that we have. It's like a corset. It wraps all the way around the core and then attaches in the front of the stomach and wraps all the way around and attaches at the spine and provides a lot of stability. We have a built-in back brace. We just got to use it, all right? And if we start putting a back brace around us, well, guess what's going to happen? Now that transverse abdominis that's already weak gets even weaker because the body's not asking it to do anything, because now the back brace is providing that support. So the weaker muscle just gets weaker because of the back brace, okay? So I'm pretty against back braces. So is the research, okay? I'm against it. The research is against it, so I'm against it too. So that's a big thing with back braces. So only use them if you need to. All right, hopefully that makes sense, guys. And then lastly, it's okay to be going at it's okay to, if you have an injury and are dealing with low back pain and you're like, it's normal to go on YouTube or go on Google and look for solutions on your own. That's great. You can definitely do that. But if you go through like 3 or 4 weeks of like self-treating and it's not getting better, make sure that you're going out and seeking a medical professional, whether it's me, another physical therapist, a chiropractor, your physician. Go get help somewhere, because if it's been going on for 3 or 4 weeks and the exercises and you're not noticing any significant improvements with exercises, you're probably barking up the wrong tree, okay? And the longer you wait for this to get taken care of, the longer the road's going to be, and it's just more time that you have to be dealing with an injury that you necessarily shouldn't have to be dealing with, okay? So that's the last piece, is seek out a medical professional. All right, so now let's get into some of the testing. I do want to give you guys some insight on where your core strength is at. And again, I mentioned earlier that the core strength gets blamed a little bit too much for low back pain. So only read into this a little bit, okay? This is just a lot of times people are like, well, I want to know how strong my core actually is, okay? So I mentioned earlier, for those that hopped on a little bit later, I mentioned earlier, grab a yoga mat. Once you guys, if you haven't grabbed one, go ahead and grab one now. If you don't have one, that's okay. I'm going to grab one here in just a second. All right, so I'm going to tilt this down here. Make sure you guys can see this. I'm going to turn it this way so you guys can see my low back. Try to wear athletic gear today so you guys can see things more accurately. with regards to what is happening at my low back with this test. All right, so what I want you guys to do is go ahead, lay on your back, okay, with your feet propped up like this. Okay? What you're going to do next is you're going to take your hands, and you're going to place them underneath your low back, like so. Okay? What I want you to do next is try and take your low back and push it into the floor. Okay? Try and squish your hands against the floor. Alright? So, from there, what you're going to do is you're going to squish your hands against the floor. Okay? And from there, you're going to raise your legs up. Okay? Keep that low back pushed against the floor. And what you're going to do is you're going to slowly lower your legs as slow as you can, okay, until you reach the floor. Okay? And lightly set them down. If you guys notice that you have a hard time doing that without letting that low back arch, or if you guys notice that the pressure in your hands decrease as you got closer to the floor, that's indicative of a weaker core. Okay? There should be, that compression on your hands should be equal throughout the entire range of motion. From starting up here all the way down the floor. The pressure should be the same. Okay? The other thing too is a lot of you guys may have held your breath. That's cheating. Alright? So I want to backtrack. Okay? Again, let's get in that position. Let's do this one more time. So instead of holding your breath, what you're going to do is when you get your legs up here, you're going to be breathing out as you lower your legs, because you can get some help from the abdominal cavity by holding your breath. Okay? It takes pressure off of how much that floor has to work. All right. So again, put your guys' hands behind your low back. Okay. And what you're going to do is push against that, your hands into the floor. Bring the legs up. Okay. Now start breathing out and slowly lower the legs. Okay. And again, shouldn't have that low back arch at all. Okay. Also, if you had pain with this, or this elicits some of the pain that you're experiencing, then this is indicative that there might be some of this core contributing to this. All right. Carly says, unfortunately, I have to run. We'll catch the replay for the end. Thanks so much. This is great. Absolutely, Carly. Thanks for tuning in. I'll be sending the exercises that we go over here in just a second to your email. If you guys haven't signed up yet, that's one thing too. If you guys haven't signed up through the registration form, go ahead and do that now so you guys can get the exercises that we're going to be going over in a second, so you guys don't have to try and memorize what we're doing today, or wonder like, hey, am I doing these exercises right? Just fill out the form that I just put in the comments, and I'll be sending the exercise to that email when we're done today as well. Okay, so go and fill that out. But I'm going to get back to that core strength. Laura says that was shaky. Guess it's weak. Okay, so yeah, shakiness can also be a sign of some weakness, Laura. However, don't get too, as I mentioned earlier, don't get too caught up in this test, guys. All right, it's just it's not end all be all. This is just one of the orders we do when somebody comes in with low back pain. I think we do probably close to 10 to 15 orthopedic measurements or tests, and so this is just one of them. Okay, there's a couple other ones that. There's other ones that we do, but like it takes it, like we've gone through training for that, and it can cause some more harm than good doing the testing if you don't know how to do it. This one's pretty self-explanatory, and so that's one I chose. But main thing is I just want to start giving you guys some insight of where your deficits may be. There's a lot of other things that could be going on. And this is just a piece to the puzzle that we use when we're doing our orthopedic assessments and our final decision-making process with that, okay? Maribeth says lots of popping in the hip joint, abs are fine. So Maribeth, what can happen is that instead of the core, a lot of times people's hip flexors will get really tight, one of two reasons, because of sitting for too long, or the hip flexors being one of the muscles that the body's trying to recruit to help provide stability for the pelvis and the spine. And so what can happen with this test is your hip flexors are actually doing most of the work, and it can cause some of that popping in that hip joint, and really the abs aren't having to work a whole lot. Let's see here. You should be, Meredith says, don't see the form for emails, also have to go teach. Thank you. Absolutely, Maribeth. Hopefully this was helpful. What I will do is, when we get off here, I'll go ahead and I will just direct message you that link if you don't mind, I'll just private message you and send you that link so you can get those exercises, okay? All right. So, any questions on that test, guys, at all? Hopefully that makes sense, okay? So, next thing we're gonna do is we're gonna get into some of the treatment. I'm gonna give you guys 3 exercises I want you guys to do. That's gonna help, 1, start decreasing some of that piriformis tightness, okay? Because I think a lot of that's what you guys get going on. 2, start strengthening up that low back, okay? And that core, that transverse abdominis, that built-in back brace. And then also doing something that's gonna help loosen up the muscles in the low back if you're experiencing muscle tightness in that area, okay? So again, you guys are gonna have to go ahead and go ahead and lay on the yoga mat. The floor is fine too, okay? So what you're gonna do, first I wanna show you guys how to start decreasing the tightness of that piriformis. I'm trying to scoot this a little bit closer so you guys can make sure you can hear me, all right? So what we're gonna do to stretch that piriformis is, there's a couple different ways, all right? What I'm gonna have you guys do is cross one leg over. So let's start with, we're gonna do both sides, okay? Because treatment is also a way to test things as well, okay? So I want you guys to start with the side that's not painful, or the side that you're not having pain or numbness or tingling down, or what side of the back you are having discomfort, okay? And what we're gonna do is we're gonna cross that leg, the leg that you're not having pain with, over the one that is painful, okay? And what you're gonna do is you're gonna grab behind the knee here, and you're gonna try and pull in the direction of the opposite shoulder. So right now, I've got my right leg crossed over my left leg. I'm gonna try and pull my right leg to my left shoulder, okay? And I should feel a nice stretch. Okay, I'm gonna switch so you guys can kind of see the glute area. Should feel a nice stretch in here, okay? Some of you guys may have some pinching or pinching sensation in the front of the hip. What I want you guys to do, remember how we put our hands behind our low back and push down? Go ahead and do that same thing while you're doing this. It helps just kind of open up that anterior hip capsule or the front of the hip joint so we don't get some of that pinching, okay? Should feel a nice stretch right in this area, okay? Ideally, we hold this for 30 seconds and doing 3 sets each side. However, time purposes, we're just going to do 1 set, okay? This should not be painful. It should feel kind of good. A lot of times people will stretch like this, and that's fine too. You guys can stretch the piriformis doing this. However, most of the time people feel more of a stretch with grabbing behind the knee here and pulling this direction. It's a little bit easier too. It's not so hard on the arms or so fatiguing on the arms. So you only have to hold one leg up instead of pulling kind of lower body. Okay. So now I want you guys to switch to the back side and check out and see what you're experiencing there. Okay. Is this more tight? Is it more tight on the back side? Is it indifferent? Does it feel good? If you're noticing that there is some definite discrepancies of sensations from side to side, especially if you feel like the back side is tighter, most likely that piriformis is tight and what's causing some of the issues as well. Okay, so again, this is treatment as well as some testing to figure out what's going on. For example, like when we do our assessments, we have a pretty good idea of what's going on when it's done, but then we start integrating some exercises based on what we find during the assessment, and that gives us more insight on were we accurate with our assessment. Is how the patient responding to the exercises consistent with what we found during the evaluation, and then kind of problem solving there. You guys can start seeing that there's a lot of different moving pieces here with regards to figure out what's going on. Okay, so that's going to help loosen up that piriformis. All right. Any questions on that, guys? Don't see any questions yet. Okay, awesome. All right. So, any questions come up about that? Just plug that in. I'm going to kind of just while I'm on the floor here, I'm going to go through all 3, and then I'll address questions once I start the back after I'm done with these exercises. Okay. So, next thing I want to that's great for people that like Laura. Laura, I think it was about that. Mentioned that when at the end of the day, you feel like they want to lay down. Okay. And then again, that's because it's decompressing the spinal segments. This exercise is going to help a lot as well. It's something that you guys can do throughout the day. So at the end of the day, you don't feel like, oh, I have to lay down because I need to get some relief. So if you're sitting a lot throughout the day, you can usually take like a break maybe every 2 to 3 hours and just do a couple reps. This is also great to do right before bed or when you wake up and you feel take your knees, go side to side. Okay, just start off with on the back track. Just start with small oscillations side to side like this. And as you get more comfortable, you can go further to the floor, like so. Okay? Again, don't let these shoulders lift up. Okay? This is going to help decrease some of these muscle spasms as well. It should feel kind of good. Okay? What you can do too is if you feel like, hey, this is a good stretch, you take one hand, place it on top of the legs, and kind of just get a little bit of overpressure. Should feel a nice stretch, kind of in that low back area. Okay, don't hold your breath, do a nice deep breath. You can switch to the other side. There. Okay, and then you can go back to doing oscillations. Ideally, do like 15 per side, nice and slow and controlled. We don't want to be flying through like this. Okay, it can actually cause some more irritation on low back. Nice and gentle rotations. This should be nice and relaxing. It should feel good. Again, if you guys have any pain with any of these exercises, stop and let me know. Okay, should all be pain free. Okay. Next thing that we want to do is start waking up that corset or that built-in back brace, being the transverse abdominis. What we're going to do that is we're going to put our hands underneath that low back. And what we're going to do is we're going to just push our low back into our hands, breathe out, hold for 3 seconds, and relax. Take a deep breath in, push your low back and your hands again into the floor, breathe out, and relax. And again, contract, relax. You might not feel like a burn, that's okay. You might just feel like a gentle contraction. You feel the muscles kind of working in this area. Some may feel also in the low back, that's okay too. Okay? Remember that muscle wraps all the way around the lower trunk. Okay? So again, just do about 15 reps here, 3 to 15. 3 sets of 15. Okay, and this should not be painful. So another thing that helps the spine, the reason that this helps the spine as well, is that low back. That low back of the spine wants movement. Okay, the spine likes movement. Again, bed rest is bad because we don't move if we're doing bed rest. The spine wants movement, and so when we're doing the lower trunk rotations, the one where we're taking the legs side to side, we're getting the rotational component of the spine. Okay, the spine, again, the spine likes movement. It likes rotation. All right, it's going to help lubricate the joints. Then the spine also moves in flexion and extension. Okay, flexion and extension. Rounding out and extending. Spine moves in that direction. When we're doing the pelvic tilts that we just did, we're pushing the low back into the hands. That's moving the spine into flexion and extension while also waking up that transverse abdominis or that built-in back brace. So we're mobilizing as well as strengthening at the same time. Okay, it's a great exercise. And so we're moving that spine in all these directions, flexion, extension, and rotation. Okay, a lot of you are going to get pain relief just by moving that spine in all the directions. Okay. Laura says this one is great, awesome. I'm glad that helped, Laura. Which one? Sorry, I was on the floor, so I was able to see which one that was. Was that the lower trunk rotations, the one where we were lowering our legs side to side, or is that the pelvic tilts where we're pushing our low back into our hands, or was that the piriformis stretch, the one where we cross the leg over the other and kind of pull towards our chest? So that will get, if I know that, Laura, that will give me a good insight of what's kind of going on with you as well. Okay. So I'll wait for that to come in because I think there's a lag. There's about a good 15-20 second lag between what I say and then also what you guys are seeing on your screen as well. So big thing is listen to your body. Your body is very intelligent. It knows what it needs, what it doesn't need. You guys know your body better than anybody. Okay, and so just listen to your body with regards to what you're feeling with these exercises, and also other exercises as well. Whether you're trying to progress back into activities or not, listen to your body. That's huge. Okay, so before we wrap up, any final questions on anything? One thing I'm going to touch on ergonomics just a little bit, because that's a huge thing. When you guys are trying, if you're sitting, if you guys are sitting for long periods of time throughout the day, make sure you have support for your low back. Okay, make sure that spine is supported here. Okay, you can use like a rolled up towel to push that low back out. The main thing is we don't want this sitting like this throughout the day. Okay, and having that low back rounded out, that's going to irritate that disc. Okay, Laura says the twisty one. Okay, so Laura, yeah, that's probably due to that one again is addressing some of the low back tightness. Okay, and as you mentioned earlier, you get relief from laying on the floor too, and at the end of the day. And so that's just decreasing that compression. Same thing with the twisty one. I like that. I'm stealing that one, Laura. So yeah, glad that helped, Laura. So yeah, if any final questions while I wrap up here, just throw those in the comments, and I'll address those as those come in too. But again, I really appreciate you guys being so interactive, and you guys have been a great group, and it's been great. So Laura asks, any climbing moves to avoid? Like you're talking about like rock climbing, Laura. Really, again, the main thing like to know on movements to avoid or do is if they're not painful. If they're not painful, most likely they're okay. The body is very resilient, guys. The body is very resilient, and it's supposed to be able to go kind of in these more weird positions and be okay. All right, it's just building up the capacity for the spine to have that capacity to do it. Okay, so most likely, if it's big thing is listen to your body, Laura. If it's not painful, then you're good to go. Okay, most of the time. All right. Laura asks, what brand chair is that? So Laura, do as I say, not as I do. This is actually, I don't spend much time in this chair actually. I only literally just do these for these workshops because it's a rolly chair. The other ones I have that are more ergonomics are more bulky and whatnot. So actually, I would actually recommend. No, I wouldn't recommend this chair that I'm actually in. Okay, but good question. Main thing is the brand of the chair isn't super important. It's really how much support that you're getting from that. I know some chairs that are super expensive and they don't provide all that great stability at the end of the day. Main thing is just keeping that spine in that neutral position and then also moving throughout the day. The best posture is your next posture. What I mean by that is keep moving, keep being active. Okay, our body's not designed to be static and sitting in one place for too long. Okay, so but like I mentioned earlier, there's early in the workshop, luckily there is a solution to all this, and it's a solution we've helped hundreds of people find. For example, we had that. I told you guys that example of the patient that was having low back pain. Went saw physical therapists, chiropractors, his physician. They all told him, "Oh, we'll just stop exercising," or the ones that didn't assess his movement. And it turned out that it was the way that he was squatting, the way that he was sitting, the way that he was deadlifting. Find somebody that's going to find the root cause of this, whether it's me or somebody else. Find somebody that knows that can tell you that and reassure you that they can get you back to doing it. And then most likely ask them to give you a track record of other people that they've helped just like you and get back to the goals that you're trying to get. Okay. But if you have come across a practitioner that says, oh, well, you're just never going to be able to do that, go get a second opinion. Okay. There's somebody out there that can help you. Okay. So I kind of wanted you guys to also envision, what would your life look like, or what it could be like if you didn't have this pain and could exercise and work out and go about the way that life the way that you wanted to. How different would you feel right now if you could be like that person that I told of the story that I just told as well, and back to being stronger than ever. So also think back earlier in the workshop about your response to how this pain is impacting your everyday life and what you're not able to do, because of it. So I want to give you guys an opportunity. We've helped hundreds of people overcome low back pain and sciatica symptoms as well. And over this time of working with people just like you, we've learned that there's a pattern to solving this low back pain. And our time figuring out these patterns led us to creating our bulletproof low back and performance program. So you guys are probably like, well, what does that look like? So here's kind of how what that program looks like. So we go through, patient would come in, you guys would come in, we go through a current and previous injury analysis. We go through a low back posture and alignment evaluation, put you through a full body biomechanical assessment. And so, because I mentioned earlier, just because you're having low back pain doesn't necessarily mean that's where it's coming from. It could be coming from the hips. It could also be coming from the ankles, actually, in poor range of motion there. That's a topic for a different day. Main thing is it could be coming from a lot of different areas. So we don't want to just zone in on that low back. We want to be making sure that the rest of the body is in good alignment and is working the way that it should. okay? And then we also do video analysis of like if somebody's having pain with squatting or deadlifting or an exercise, then we do a video analysis of that and see where are the movement mechanics breaking down and where can we improve that, because again, it's all about finding the root cause. So I know you guys are probably thinking, I just don't know if this will work for me. I don't have the time or money right now. I don't think physical therapy is what I need to solve right now. And that's fine. But I'm going to turn back to, a lot of you guys have been dealing with this for a long time, okay? And, how willing are you to tolerate this for even longer? Because most likely, I don't want to be the bearer of bad news, but if you've been dealing with this, you've been trying different exercises on YouTube, seeing multiple practitioners, stuff like that, it's just not getting better. Most likely, it's not going to get better until you find the right person that can help you and give you a roadmap of how to get it. And don't get me wrong, I tell my patients this all the time. I don't fix people. People fix themselves. I just give them the roadmap on how to do that, right? Giving you guys guidance on what exercise you should be doing, what you should not be doing, finding the root cause of this. It's really for the work that people put in outside of seeing me. People are only with me for an hour, okay? I just give you guys the roadmap, okay? I'm big on empowerment. I want to give you guys all the tools and education that you need to solve this issue. I don't want you relying on me, a chiropractor, massage, or anything like that. So, but I hear it all the time from patients when they're done with us is they're really hesitant to start because they've been to so many other practitioners that weren't able to help them, and it was a waste of time, and they're worried about wasting more of their time. So, but when they get done with us, they're like, oh my gosh, I wish I wouldn't have waited so long to do this. I wish I would have started earlier because I really didn't realize how much this low back pain was impacting my life and how much I missed out on until I actually got this problem fixed. So people are usually super happy that they went through with it and pulled the trigger on it and got back to living the life that they wanted to. So you guys are also probably wondering, how much does this cost? What's the investment on this? So to get the current and previous injury analysis, the low back posture and alignment analysis, full body biomechanical assessment, video analysis, and then come up with a prescribed plan of care, typically it's $225. However, if you schedule a day, you guys get 50% off. So you guys get all this for just $112, okay? And then we start making progress with this, okay? And typically patients with low back pain typically only need 5 to 10 visits with us, and they're back to living the life that they want to. They're back to exercising pain-free. They're back to sleeping throughout the night. They're back to just enjoying life and seeing all that it has to offer, free from back pain too. So again, we're not here to I don't want you guys coming in for 20, 25 sessions. That's not what it's going to take. That's ridiculous. If you go in and you see a practitioner and they say it's going to take 20, 25 sessions, you're not with the right person. Okay. So usually 5 to 10 sessions, but we'll know more obviously after initial evaluation. So if you guys want to get started with that, to fill out what I'm going to be doing is I'm going to be limiting this to only 3 people. This offer is good for the next 24 hours. So if you guys want to take advantage of this, make sure you act on it soon. I'm going to drop the link in the comments of the form to apply for this. Because again, we always screen everybody before we start working with them. I'll actually hop on a phone call with you guys if you're interested in starting. We do help people virtually as well as in person. Actually, I think we've got about 10 to 15% of our caseload is virtual. And we just got done working with one person that was having low back pain that was in Arizona. And they're back to, and we never saw them in person, and they're back to, we were able to help them get back to everything that they wanted to too. Again, it's not the hands-on stuff, it's the exercise and empowerment that we give you guys that ultimately gives you guys the results that you want to, okay? So if you guys want to take advantage of that, fill that form out and apply. I'll be reaching out to you guys through phone if you apply through that. Within 24 hours, we hop on a phone call. It's pretty extensive. It's a good 10, 15, sometimes 20 minutes. I just learn more about what's going on with you guys, what you're having pain with, how long this has been going on for, what you're having difficulty with, what you've tried, what's worked, what hasn't worked, and then also decide ultimately if you guys are a good fit and somebody that we can help. Because I'm not here to waste your guys' time. I'm not going to have you guys come in or do an assessment if I don't think I can help you. And that phone call gives me a good idea of what your goals are too, and if we can help you meet those as well. All right. So after the phone call, I have a pretty good idea if we can help you or not, and if so, then we'll have you come in for an evaluation, or we do it virtually as well. So if you guys want to take advantage of that, the link's there. Hope you guys found this beneficial and whatnot too. I'll be sending the exercises to your guys' email here shortly. By the end of the day today, you guys should have those. Check your junk mail. Sometimes it'll get sent there. So if you guys don't receive it, you can message me through Facebook, or you guys could just really, that form that I have here, even if you're not interested in the evaluation, that's fine. Just message through there like, hey Ben, I attended your workshop. I didn't get the exercises. Can you send it again to this email address, and then provide the email address, and then I'll send that over once I get it. Okay, guys. But yeah, that's all I got for you guys today. If you guys are dealing with any other injuries, let me know, because we do these workshops about every other week. Next workshop I'm thinking about doing is possibly knee pain or shoulder pain. So I'll be letting you guys know, or we work with a lot of runners too. So I might be doing a workshop on pain with running. So if you guys have a topic that you guys want me to specifically touch on, just let me know, and I'm happy to do that for you guys, okay? But yeah, if you guys have just general questions, you want to hop on a phone call and kind of pick my brain on anything or a topic, I'm happy to help out any way I can, okay, guys? So, but yeah, again, hope you guys found this beneficial, and I hope you guys enjoy the rest of your Wednesday and the rest of your week. All right, bye, guys.